Okay, so I'm going to start at the top. Okay, so just so that you can orient yourselves, this right here is the larynx. You can feel it. It's kind of firm. Okay, that's the larynx. Right below from the larynx, that's the trachea. You see the trachea?
I can't see, but is it the ribbed one?
Yes, the ribbed one. Yep. Okay. And then behind the trachea, if you kind of move everything to the side a little bit, there's going to be a tube. And then that tube is going to be your esophagus. We may have cut it. Did we cut the esophagus a little bit here? We may have cut a little bit. That's okay. This is the esophagus. Okay. So it's a muscular tube that's behind the trachea. You see that muscular tube right there? That's your esophagus. Okay. This is your trachea. So right lateral to the trachea is going to be the right common carotid on the right side and the left common carotid on the left side. Do you see that? Yeah. Right there, the pink one. Okay, this is the left common carotid. This is the right common carotid. Okay, this is the right common carotid, left common carotid. This is the vein that I believe was the vein that was injected. This is the external jugular. The one right next to which is not really on this one. It's kind of cut off. Right here, right next to the pink one is going to be the internal jugular. So you got the internal jugular and the right common carotid. So the right internal jugular and the right common carotid. Along with it is going to be the vagus nerve. This is the vagus nerve right here. Okay, the vagus nerve, which I may have just cut off a little bit. Okay, that's the vagus nerve right there. Okay, I cut off a little piece of it. Vagus nerve. Okay, now, this here is the, coming right off of the heart underneath here, which I haven't really isolated, is going to be the right subclavian. Okay, that right here is the axillary artery. And notice how it goes into the arm. That's the brachial artery. Okay, that's the brachial artery. Because we're like at the level of the elbow here, so that's the brachial artery right here. Okay, brachial artery. Okay, now, a little bit lower below the trachea is going to be the heart. This is the heart. Okay, the heart is surrounded by a pericardium. Okay, so you can see the pericardium. Yes, the clear membrane. We're going to take the pericardium out. Okay, that's going to be your heart. Okay, that's your heart. And then this thing right above the heart, which is kind of attached to the pericardium, this is the thymus. That thing is chunky. That's the thymus. So that's a really good one, okay? Guess what? You're going to see that again, okay? The thymus. So I'm going to move the thymus back, and then I'm going to leave the heart. Now, remember, this is your interventricular sulcus, right? With your left anterior descending artery in it. This is the artery that most commonly needs to be bypassed in humans, okay? The one that goes on the anterior and the sulcus right there. Remember, this is the apex. So if it's the apex, you know, this is the left ventricular. This is the muscle. The ventricle technically is the space inside, right? But you know that's going to be underneath there. And this is going to be the right ventricle inside there, right? So this is what we call the myocardium, right? Of the right ventricle, myocardium of the left ventricle. So above this, you're going to see this. Ooh. It makes a noise. Okay. It's a squeeze toy. Squeeze. Okay, so right above it, right here, this is going to be your right atrium. And if you look, right, this is your left ventricle area. This is going to be your left atrium, right? Right above that. Just remember, orient yourselves, okay? Orient yourselves so that when you're looking at it, you're like, okay, this is this, this is this, this is this, and move your way up. Don't just sit here and try to memorize everything just willy-nilly, okay? And remember that, you see this is the right ventricle area, yes? Look at the blood vessel that comes right off of that. What blood vessel is that? That comes off the right ventricle. What's the big one? Moving away from the heart. Trunk. The pulmonary trunk. Remember, pulmonary trunk is always anterior. You see that? First that one, and then behind it, do you see that right there? That's the aorta. Okay, do you see that right here? That's the aorta. And in order for us to best see the aorta, we're going to take our scissors, we're going to break apart this a little bit here. Okay, so we can see the two blood vessels come right off the aorta. This is your vagus nerve. It's like attached. Okay, you can see right here, two blood vessels coming off the aorta. Because remember, in pigs have two. Humans have three. Okay. Excluding this little knob. Okay, do you see that? Two blood vessels. The first one, brachiocephalic trunk. The second one, right subclavian. Remember, pigs have a right subclavian comes off, no left common carotid. The left common carotid comes off of right here. You see? This is the left common carotid. It comes off of right there. Okay? So then, huh?
Oh, no.
Okay. So then going down a little bit, around the heart is going to be the lungs. These are the lungs. Okay, so this is going to be the left lung. Notice it has two lobes. This is the right lung. The lung is going to be on the first midterm. Okay, and notice the right lung has 1, 2, 3 lobes. It's superior, middle, and inferior lobes. Okay, then past that is going to be your diaphragm. This is your diaphragm. And this is your inferior vena cava. You see this? Inferior vena cava?
The blue.
Yep, the blue one. I'm going to try to break open.
Yeah.
Where's the superior?
Here's the inferior vena cava. I'm going to go try to find the superior one right now. See the inferior vena cava? Really big. Really easy to find. That one should be a really good one on any test, okay? Big one. Now the superior one is right here. This is the superior vena cava.
Oh, I see it.
Wait.
It's covered by some stuff.
This one right here is the superior vena cava. You see that? I'm breaking apart the tissue a little bit, but then that shows the blue inside, which definitely confirms that it's a vein. Okay? That's the superior vena cava. And that's the inferior vena cava. Okay? There's like a little bit of pericardium still around the heart. Okay? This is the diaphragm. And again, I mentioned earlier, the diaphragm is kind of clear in the middle. That's called the central tendon of the diaphragm. So the diaphragm and all up to here is going to be on your first midterm. I'm going to go through a few things here, including some blood vessels, that it's not going to be. That's going to be more for the second midterm. Okay? More for the second midterm. Okay? Some blood vessels first. This here is your umbilical vein. These here are your umbilical arteries. The umbilical arteries, here and here. Okay? This is your umbilicus. See? This is the umbilical cord, right? And then right here, right and left, umbilical arteries. This is the umbilical vein. Remember, in babies, yes, in fetal development, this vein that you see right here is moving oxygenated blood from the mother, because mother did the breathing, through the liver to the inferior vena cava to the heart. Okay? That's what this does. It goes and it bypasses the lungs. It doesn't let them, the babies aren't breathing, so they can't pick up their own oxygen. All right, so this is the liver, okay? The liver below it has a gallbladder, which on here is a little bit messed up, like a little bit torn. So that's the gallbladder, okay? That's the gallbladder. This is the stomach. Okay, this is the spleen. This thing right here, this is the spleen. Looks sort of like a tongue. Okay. Right below, okay, right in here is the pancreas. Okay, that you see that chunky stuff right there? All that chunky stuff is the pancreas. It's all pancreas. Okay, that's the tail, the body, and then the head and neck up here. Okay, you see how it does like this? Whoop, whoop. Whoever you are, you need to send that to everybody because you got the best video from right above. Okay? And then, so I'm going to move behind the pancreas because you can see some blood vessel right there. You're like, ooh, that's a blood vessel. So what we're going to do is we're going to move over. This is the large intestine, by the way, the spiral colon. This is the small intestine. And in the terms of blood vessels on the small intestine, I want you to notice the mesentery. You see the mesentery? All of that, the pretty sunburst looking like thing. Okay? That's the mesentery. Okay? I'm gonna move this to the side a little bit so we can see some of these blood vessels that I isolated earlier. And look, it all got dirty again. Okay. It's a little bit of blood because it's all that the brown stuff is all blood. Okay, so I'm gonna put a little bit of this. That should hopefully. Okay, so this here, this big vessel right here. This by the way, the green one. That's the rectum. This one here is you see how it's thick and it's round? That's your abdominal aorta. This one's the abdominal aorta. And then this one right next to it, a little bit flatter, but still big, that's your inferior vena cava. Okay, the inferior vena cava and the abdominal aorta. Okay, now this here, this is the kidney. Okay, and then this is going to be the renal vein. Okay, and then the renal arteries are right here.
Where's the kidney?
This is the kidney.
Oh, okay.
And then the renal veins are going to be deep. You see that's the renal vein right there. Do you see it right there? Okay, that's the renal vein. And then this is the renal, renal artery. This is the renal vein. Renal vein is up here. This is the renal artery. One of them, because it should have two of them. And there's one on the other side, of course. Okay, now, when you go deeper, now here, you can also see the gonadal arteries. Okay, so the gonadal arteries are right here. That's going to go right through there, through here, and these are the testicles, okay? These are the testes right here, okay? Actually, this is the testicle right here. This is the little sac it's supposed to go into, but they're fetal, so their testes haven't descended yet. This is the testes. This is the epididymis. This is all for like the second half, but since it's already there, might as well just point it out. Okay? And then you could see this is the vein, you see? The artery. See how I'm tugging and it's pulling on here? That's a testicular artery right there. So notice how thin it is. That's the gonadal artery, and in case it's the male testicular artery. Yes? And then here is going to be where your your artery is going to split. Do you see it? The split right there? That's the split.
The upside down V.
Yep. You see it? Okay, that's the split right there. That's the common iliacs. Okay, do you see it?
Oh, it's really low.
Yeah, it's way in there. Okay, and then here, along this leg right here, I see it right here. This is going to be the femoral artery. You can see that right there. That's a big one. Okay, that's the femoral artery. It's coming off of right there. That's the femoral artery, which I can isolate it if you want to, but you're not gonna be asked that. Okay, what did I miss? I think that's about everything. That's pretty much everything for like the whole pig, except for like the salivary glands and stuff. We'll get to that.
What about common ileus?